Long live Little Brats.
And the Cutting Edge Project. Medical students learn through textbooks, lab experiments, and lectures. They memorize body parts, processes, and conditions and then dutifully demonstrate their knowledge during exams. But until recently, nowhere during their training did they learn to improve their communication skills. Thanks to my guest, Dr. Preetha Krishnamurthy, medical students are learning how to better communicate with patients and be more empathetic. Hi, Preetha.
Hey, Mirko.
Thanks for taking the time to talk to me about something that I know is near and dear to your heart, empathy. So what I want to know is why you felt it was important to develop a session on communication for medical students.
When medical students go through their training, they have different rotations. And one of the rotations they do in their third year is pediatrics. And historically, I always find that students are terrified of doing pediatrics. And what really scares them is how to communicate with families. That communication piece, which is really the heart of pediatric medicine, is something important that we need to address in the curriculum. So that's why I created this session for second year students to actually practice these difficult communication scenarios so that they feel a little more ready when they start their rotation in pediatrics.
So I've known you for a long time, and I know that you're a very caring person. Have you ever been in a situation where you felt that your communication skills were lacking?
Absolutely, and I think we all have in medicine. And I actually really distinctly remember this event that happened when I was a junior resident. And I had to tell a parent that their child's blood test sample was lost and we had to repeat it. Needless to say, they were not happy, they were angry, but all those emotions they had were very normal emotions, but I was ill-equipped to really handle them. Had I practiced, I probably would have been better at delivering the message.
And there's been many times when I thought I could have delivered a message better. So I see the value in this. So my next question is, how do you teach medical students empathy?
So the session we've created with one of my colleagues, Dr. Ladd, and a former medical student who actually was involved in the process, is done by Zoom. And I actually have actors who act as family members and parents. And I've created various scenarios that we thought were reflective of common situations we see in pediatrics. They actually do the scenario with the actor, and there's a facilitator, and we observe them and give them feedback. They're not graded on it. It's purely a formative experience for them to feel like they're in the hot seat.
To give them some practice.
Exactly.
So in your mind, what do you think are the benefits of this session, if you will?
Number one, just watching each other. They'll say, oh wow, that was done really well, or maybe I'd do this differently. And the second thing is there's a small group facilitator who's experienced and is able to give them tips based on their own clinical practice.
So I can't think of many people that are better positioned for this, and I know that you've been honored by the McGill faculty with an Osler Award, which for all those that don't know is an award that goes to somebody who is excellent at, guess what, teaching. So tell me a little bit about how that plays into your practice here at the Children's.
The Montreal Children's Hospital is a teaching hospital, and that medical education is one of our pillars and missions. To me, teaching is something we should be doing day to day. It's about role modeling. It's about having students come with us and see what we do, giving them the opportunity to see patients in practice as well. And I love teaching because it reminds me of what I love about medicine. And I think that's something we always have to remember.
Thanks for sharing with me. It's an amazing thing that you're doing. I think it's super important for students to learn those skills. So thanks for taking the time with me today.
Thank you so much, Mirko.